folks. John Adamson, the Rehab and Documentation Guru. And I like to wait just a minute at the beginning there because sometimes it misses like a word or two doing these lives. And so hopefully you're doing well. It's been just a little bit. I've been just covering a series of words to consider when you document. And today's word is the word necessary. So we've gone over safety, effectiveness, reasonableness, and now necessity. And so, what are some key things to think about when you're documenting to prove necessity? And part of the word necessity ties back to the previous words that we've talked about. So, I'll give you example as we move along here. But one component of proving that your care is necessary is that it's just plain needed. Something needs to be done. So, in the rehab world, we document from a prior level of function standpoint to where the patient is now once they come to us, that there's been some kind of decline. And so, in a sense, something's needed. If a patient has faced a decline in functionality, something needs to be done. So, part of proving necessity is showing that decline. And therefore, it may be necessary that you're needed. So, the question is, why would therapy be needed? So let's talk about those previous words that I was talking about. So we talked a little bit about the word safety a few weeks ago and what that means to proving medical necessity of your care. So one reason you would be necessary to treat a patient is that you're the only one that can safely do something. So um, I'll give you for instance, in the medical world. So I'm helping with a product argumentation for medical necessity that has been shown to not only be safe when administered by a specialist in that given area, I can't divulge any more than this, but also it is safe to be done by a general surgeon. So this product does not demonstrate the necessity of a particular specialization, even though you would think that this specialist would be the primary one to do this particular surgery. But in fact, a general surgeon could also do it safely. And therefore, it does make it clear that a surgeon is necessary. Sorry, guys, went out briefly. So, for instance, one of the things that makes us more necessary to do something is not just about the safety, but it is also about the efficacy. So you would be more effective in doing this intervention than, let's say, somebody else. It's more reasonable to have you do this intervention than somebody else. So I'll give you an example that therapists would be somewhat familiar with. We have the world of podiatry or podiatrists, doctors, DPMs, doctor of podiatric medicine, versus the orthotist. And so you know, probably from your experience working in rehab, that both podiatrists and orthotists can make something called orthotics. And an orthotic can be used on any part of the body to augment the movement or facilitate the stability of, probably come up with some other terminology, of a particular joint or segment of the body. And that's generally what an orthotic does. Well, an orthotist can do that, so can a podiatrist when we're talking about the lower extremity, but guess which one costs a lot more? So in this case, if somebody needs an orthotic for the lower extremity, is it reasonable to, rather than pay for a podiatrist to do it, to pay for an orthotist to do it? It would be a lot cheaper. And so when we're arguing necessity, we can't really say that the podiatrist is absolutely necessary to providing the orthotic. So it could present, from a reimbursement standpoint, a little bit more challenges. So when you think of necessity, you are going back to those previous words that we talked about, proving that only you could safely do it, that you are the most effective means, and that you're the most reasonable. I'll give you another, for instance, addressing just a diagnosis: back pain, low back pain. Studies have shown consistently that physical therapists treat back pain with outcomes similar to orthopedic surgeons. And you can imagine which one of those two is much more costly. So it is more reasonable to at least try. Because let's face it, there's going to be reasons for doing surgery. Absolutely. My mom recently had spinal surgery. What she had, there was nothing a PT could do. She needed to go through orthopedic surgery, got it done. But in reality, most diagnoses related to back pain probably would benefit from an initial bout of a much more reasonable intervention in terms of cost, physical therapy. And if the outcome shows progress, effectiveness, then it was clear that physical therapy was necessary. So, anyway, these words, safety, effectiveness, reasonableness, and necessity, all tie in together. And so, as you're documenting them, think about how they interrelate and how they're distinct. And hopefully, now you have a little bit better understanding of the word necessity. Anyway, I appreciate your time. Like and comment. That helps the YouTube algorithm. And I look forward to speaking with you soon. Take care. God bless.